In this video, which is the last part of the Myasthenia Gravis series, I will talk about the treatment of Myasthenia Gravis. So, first of all, we can give the patient acetylcholinesterase inhibitor such as neostigmine and pyridostigmine. And so what these drugs do is they go to the neuromuscular junction and they inhibit this enzyme over here that are breaking down the acetylcholine neurotransmitters. And in myasthenia gravis, we need to increase the acetylcholine neurotransmitters. So by inhibiting these enzymes that are breaking down acetylcholine neurotransmitters, well, we will increase the concentration. But these drugs by time will be less effective because imagine by time in patients with myasthenia gravis, the receptors are getting damaged. So even though if you increase the concentration of acetylcholine neurotransmitters, well, there is not enough receptors to bind to. So in that way, by time, this drug might become less effective. Another drug we can give is prednisone, which is a corticosteroid immunosuppressive. And the function of this is to reduce the activity of the immune system. And by doing that, well, we will also reduce the amount of antibodies that are causing the problems in the neuromuscular junction. But let's say that these drugs does not work anymore if the disease has become so severe that there is no response to these drugs anymore. Well, then we can go and do plasmapheresis or intravenous immunoglobulin. And these two types of treatments are also given before surgery or thymectomy, which I will talk about in a second. So first of all, plasmapheresis is especially given, as I just said, in patients that are poorly responding to other type of treatment. And plasmapheresis is a process where the plasma is filtrated, and by doing that, well, some of these antibodies will be removed. So the benefits of this treatment is only around 4 to 6 weeks. And then we can also do intravenous immunoglobulin, Igiv, where the patient is given intravenously 400 milligram per kilogram for 5 days. And so what the function of this is that it will go and neutralize the autoantibodies that are causing the problems, and it will go and stop the production of these autoantibodies. And lastly, we can do thymectomy, which is where we remove the thymus. So if the patient have any disturbance in the thymus, let's say they have thymoma or hyperplasia, well, the surgery have shown to be very beneficial in those patients, because by removing the thymus in these patients that are producing these antibodies that are mistakenly attacking the neuromuscular junction, well, we will stop the production of these autoantibodies that are damaging the neuromuscular junction. And also it's seen that in patients specifically with acetylcholine receptor antibodies, the surgery has shown very good results. And also if the patient has generalized symptoms, so let's say like they have symptoms in their head and or in their legs, like very generalized symptoms, well, it has also been shown to be good to do the thymectomy in these patients. And of course, if the patient is severely ill, so the patient has problem with their respiration, well, then we have to do intubation and ventilation in cases necessary. And of course, in cases of myasthenia crisis and cholinergic crisis where the patient is having respiratory failure. So this was everything about the treatment of myasthenia gravis. I hope that you enjoyed the series of myasthenia gravis. Thank you for watching.